I'm doing my op-ed video on the over-diagnosing and over-prescribing of medication for children with ADHD. First, we're going to define what is ADHD. ADHD is a attention deficit hyperactivity disorder. It is a behavioral disorder that begins in childhood and usually persists into adulthood. Behaviors are often exhibited by most children at particular points in their lifespan development. It is estimated that 1 in 20 children are diagnosed with ADHD. According to the American Psychiatric Association, it states that it is a developmental neurobiological condition that is defined by severe or pervasive symptoms of inattention, hyperactivity, and impulsivity. It states that a child must exhibit a number of inattentive, impulsive behaviors over a period of 6 months before the age of 7. It should be present in home, school, and impair daily functioning. Some of the stimulant drugs that are used are Ritalin, Adderall, and Dexedrine. There are two types of ADHD. Type 1 ADHD involves inattention without hyperactivity. Type 2 ADHD involves hyperactivity without inattention. The symptoms of type 1 involves trouble paying attention, trouble following directions, trouble following through with tasks, shy or withdrawn behavior, easily distracted, seems disorganized or careless, slow to process information. Type 2 involves trouble paying attention, restlessness, impulsive speech and actions, excessive talking, loud interactions with others, difficulty waiting turns, frequent interruptions, overactive, may have a quick temper. The side effects of these medications involve hallucinations, hearing voices, grandiosity, loss of interest in activities, anxiety, headaches, decreased appetite, abnormal behavior, suicide ideations, depression, and insomnia. Due to the fact that ADHD is a controversial topic, the American Disability Association created an act which gives entitlement to all students with disabilities a right to a free, appropriate public education in a safe environment that is in line with their needs. It's also develop appropriate, individualized educational plan for each student. The IDA also mandated that particular procedures are followed in the development of an IEP. It should be conducted by a team of knowledgeable persons and reviewed annually. Based on the team involves the child's teacher, parents, the agency representative, and sometimes even the child. If a parents disagree with the proposed IEP, they can request a due process hearing and review from the state educational agency if the applicable in that state. Factors contributing to mixed diagnosis and overprescribing of medication in children ADHD. So I broke it down into 3 aspects. So I believe it starts in the home. So with the lack of parent-child interactions, it leads to an increase in technology. And with that, the child overuses technology, which leads to the development of behaviors that links to ADHD-like traits. This deficiency in parental involvement leads children to find alternative solutions to manage the absence of affection and quality time. So within a school setting, teachers are quick to label these students that mimic these behaviors, which leads to over-diagnosing and misdiagnosing. So in many settings, professionals are pressured to find a quick solution to difficult behaviors of young individuals. And these assessments are sometimes come from parents and teachers looking for an immediate treatment plan. And it's oftentimes linked to traumatic symptoms. So oftentimes children within the classroom may be experiencing traumatic maybe going through traumatic experiences, and sometimes teachers don't even know, but it the behaviors are similar to ADHD like traits. So within the drug aspect, stimulant production quotas are published yearly by the Drug Enforcement Administration. Prescription rates are complex and vary by geographic location, age, and gender. Studies have shown that overprescribing in some regions of the United States and underprescribing in others. There's also evidence that these symptoms interfere or reduce the quality of social, academic, or occupational functioning. These are the models of disability that applies to ADHD overdiagnosis. So applies the medical model, which is presented as viewing disability as a problem of the person directly caused by the disease, the trauma, or other health condition, which therefore requires sustained medical care provided in the form of individual treatment or professions. It also applies to the moral model of disability. It refers to the attitude that people are more responsible for their own disability. For example, some cultures may view a disability as a result of bad actions of parents, karma, or result of practicing witchcraft. Treatments of ADHD. So, in this diagram, you have medication, medical support, psychologists or psychiatrics, dieting, school or work, parents or partners. The progress made and the alternative solution. So there is a growing political strength of children's welfare advocates and mental health consumer movement associated with decreasing the stigma resulting in changes to federally funded special education programs. The Individuals with Disabilities Education Act recognized ADHD as a disability, and children with ADHD became eligible for school accommodations. Beginning in the 1990s, Congress expanded eligibility criteria for Medicaid, especially for children. This fueled a rapid increase in coverage for psychotropic medications and stimulants. With the increase of medication, psychotherapy and other treatments can be useful in helping a child to control behaviors like dieting, meditation, self-soothing techniques, talk therapy, CBT, and solution-focused brief therapy, being connected and engaging in outdoor activities. So the last two were taken from a reading that we did in class. Solution focused therapy is useful, and it's a student-centered approach to improve the school's climate, classroom, and with the use of goal setting. To conclude, based on my research and classroom, I believe that there should be a more in-depth assessment of children behaviors before diagnosing them with ADHD. To prevent overdiagnosis in children, parents have to be more involved in how they are implementing their assessment of the child and the evaluation process. They need to seek out additional assistance, do research, ask questions, find an alternative solutions, and use only evidence-based intervention.